Morning, everyone. This is Thursday, April 2nd. Cases of coronavirus, as we all know, are still going up. Let's see. Overall cases in the U.S., 215,000, 5,000 deaths, 8,800 people have recovered. Many active cases still, obviously. New York is 83,900 with 2,200 deaths, and New Jersey is 22,000 with 355 deaths. So, cases obviously still going up. Hoping to see a bend in that curve in the next few weeks. But I'll have to say. Starting to get more stay-at-home orders. I believe Florida has now finally put a stay-at-home order in place. And also some of the other states are. Good morning, Nancy. How are you? Is all your family doing well? My post yesterday was about rheumatoid arthritis and diet. I've encountered patients who, when they go to their conventional doctors and ask about diet, that there is woefully little good advice there. So I wanted to bring that out. Rheumatoid arthritis, any of the autoimmune diseases. Have dietary components. Nancy, I'm so happy to hear that you guys are good. Hoping that for everybody, for everyone, obviously. Um, yes, so any of the autoimmune diseases can have dietary components, you know, relations to the microbiome. Again, the most of the immune system is in and around the gut, and so if there is a disturbance in that immune system, then there is, we can get into autoimmunity. So diet certainly can play a role in that. And we can alter autoimmunity by what we eat. We are some people have genetics that predispose them to autoimmunity, but the field of epigenetics tells us that autoimmunity, the genes can be activated or deactivated by what we eat. Good morning, Caitlin. How are you doing? And how's your family? So yes, just talking about autoimmunity and diet this morning. It's really important what we eat. It's important that we eat an anti-inflammatory diet, which usually involves lowering the amount of grains in our diet, the amount of gluten in our diet. For some people, dairy is often a big culprit for people. You can, as our friend Dora Mullen was fond of saying, Dora Mullen, who created the suppers program, is fond of saying that, how you feel is data. When you eat something, notice how you feel, and if it makes you feel badly, probably is not good for you. Probably, probably um, is creating either some inflammation or you have some sensitivity. So I would recommend that you know, pay attention to that and try eliminating that from your diet for a while, to see how you feel, see if it makes you feel any better. And then after a period of, usually if you eliminate it for a period of 3 weeks, and if you're unsure about it, then reintroduce it and see how you feel. And usually that period of reintroduction is eating it every day for 3 days to see how you feel, see if it makes you feel worse. So that's the basic principles of the elimination diet for anything you want to see if it's bothering you. Um, so we can talk about that more in future Facebook Lives. Um, and let me get to a question in a minute. Nancy says, my husband has been suffering some back and leg pain since January, possibly related to a fall. Gave him got some injections. Well, this, so there were some steroid injections, and Danzy's question is, how do the steroids make him vulnerable at this time? Well, the steroids are certainly immune suppressants, so that would, for a few weeks afterwards, make him more susceptible to any kind of infection. Um, so I would, yeah, take extra precautions for sure. Um, and, uh, I guess when it's injected, at least it's more in a localized area and releases more slowly rather than taking it systemically, but it does get absorbed systemically. So, yes, I would say, there is certainly an increased risk of, suppressing the immune system. Um, be careful, be extra scrupulous about your precautions. I'm sure you already are. Um, so, all right. So does anyone have any questions about the role of diet in autoimmunity? We've talked about certainly um, for immune support, eating, generally eating a high phytonutrient plant-based diet. All those good phytonutrients. Doesn't have to be exclusively plant-based. I mean, certainly fish is great for you also. Occasionally putting in some organic meats can be good if you choose to do that. But staying away from the important thing is to stay away from processed foods, sugar, that kind of thing. Those types of diets create inflammation and can suppress the immune system somewhat. Not to degree as to someone who's immune compromised, but certainly make it not work optimally. Let's see. Any other questions or anything? What else about diet can we bring forth about? You know, we've talked previously about how certain supplements, things like curcumin, is anti-inflammatory and helps support the immune system. Vitamin D can be a good immune system support, but there's some evidence that if you start to come down with symptoms, you should probably stop it. Um, Theoretical evidence, anyway. Um, and um, many companies are selling immune support packets that often have mushrooms and other phytonutrients that help support a balanced immune system, and we are certainly recommending that to help people with immune support. Um, so, and again, for the coronavirus, just want to mention again, in case anybody wasn't on, that there is a recommendation now to wear masks when you're out in public. They've decided that it actually decreases transmission. Does that in a couple of ways. If you have anything, if somebody is asymptomatic, um, and they wear a mask, they're less likely to put their droplets out into the environment. Um, and if you are wearing a mask, it keeps you from taking those droplets on your hands and putting them by your nose and mouth. So, and we're talking about more like the surgical masks, not the N95 masks that the medical workers need. We don't want to be using up those supplies. Or a bandana or a scarf would serve the same purpose to just cover your nose and mouth and prevent, again, you from putting droplets out into the environment and from using your hands to put droplets in. So that's the latest advice on the coronavirus. And if anyone has any questions about functional medicine or any suggestions about, what they think, I need to educate the general public on, I'd be happy to take those. I want people to realize that there's a different way of doing medicine, integrative medicine. Seeing integrative practitioners, I believe, can, improve people's health by working on lifestyle and nutrition, which is often neglected during conventional visits. So, if there is nothing else, I guess I'm going to keep it brief this morning and sign off and wish everyone a great day. All right, everyone, take care. Talk to you soon. Bye bye.